Next speaker is Paul Lasko.
So I'm grateful for the opportunity to speak here today. I've been asked both to speak about Canadian efforts in rare disease and also about the International Rare Disease Research Consortium and how both of those efforts link to the Global Alliance, all in about 7 minutes, and I've probably used one of those minutes already, so I'll get on with things. So in Canada, we were able to form a consortium through funding from the Canadian Institutes of Health Research and Genome Canada, which was initially called the FORGE project and now is called Care4Rare. And the leads on that were Drs. Kim Boycott, who many of you probably know, and Alex McKenzie at the Children's Hospital for Eastern Ontario. But this was a national project. This involved 21 sites around Canada, 80 clinicians, and about 50 scientists working with pediatric rare disease patients all over the country. This project started in late 2011, and continued until 2014, where it's morphed into a larger project led by the same two individuals, now called Care4Rare, which is not only just limited to a diagnosis project, which is the first one, but also involves developing new therapeutics and also working with patient organizations and other stakeholders to help develop better means of getting genomics into the clinic in Canada. So the outcomes of the first part of this, the FORGE project, were that causative mutations were identified for 146 rare diseases, and of those, about half of them were new genes that had not been linked to rare disease before, and the other half were novel presentations of or different alleles of genes that had already been linked to rare disease, but not to that particular rare disease. And over 500 families, not just in Canada, but worldwide, because this involved a lot of international collaboration, received diagnoses for their children's conditions. So how does this link to the Global Alliance? Well, I'm fortunate because Heidi Rem actually did a lot of my work for me here this morning. So the database that resulted from this project is Phenome Central. And so as Heidi told you this morning, Phenome Central is an integral part of Matchmaker Exchange. So it's now linked with GeneMatcher in the States and now Decipher in the UK. And Phenome Central very much supports the federated model for data sharing, even to the extent of having the hub and spoke model as opposed to the web work of binary searching, which is the other possibility. And we see no major barriers that are unique to Canada that will prevent this. Of course, these projects, while they lead to diagnosis of patients and they involve return of information to patients and their treating clinicians, these still are considered research projects, and patients are consented for international data sharing when they take part in these. I'm also here on behalf of the International Rare Disease Research Consortium, which I chair the executive of. IRDiRC, as are CIHR and Genome Canada, are all members of the Global Alliance. IRDiRC predates the Global Alliance by a couple of years. It started in around 2011, and the rationale for forming it was the idea, a similar rationale to the Global Alliance, that improving international collaboration and facilitating better data sharing among rare disease researchers could better facilitate research and could reduce inequalities for patients. The organization set two overall goals for itself when it was founded, and that was to catalyze the developments of diagnostics for most rare disease, and also to catalyze the development of 200 new rare disease therapies by 2020. So one difference between IRDiRC and GA4GH is that in some ways GA4GH's mandate is more narrow and that it's really about data sharing. On the other hand, in terms of the diseases it considers, it's much more broad. We have IRDiRC has a narrower mandate in terms of disease area, but a broader mandate in terms of the activities that it's trying to do to improve treatments in those diseases. In terms of those goals, we're not doing too badly as an organization. So there now are about 3,400 genes linked to rare disease. That was at the end of last year, and that compares with about 2,400 in 2010. So that's pretty good progress over the first half of IRDiRC's mandate. How close we are to the goal, we don't know, because we don't know how many rare disease genes there are. So estimates range between 5,000 and over 10,000 rare disease genes. If it's closer to 5,000, then we're on track to get to where we need to be. If it's closer to 10,000, then clearly we have a lot of work to do, and lots of research is going on to try to discover how many undiscovered rare disease genes. Most of the ones that we have discovered has been as a result of whole exome sequencing. We don't know how many we're missing because the causative mutations lie outside coding regions or otherwise complex. In terms of therapies, we're clearly on track, 144 as of the beginning of this month, and they're coming out at about 30 per year. And we're counting therapies as new therapeutics with an orphan drug designation, either from the FDA or from EMA. There's a lot of interaction between IRDiRC and GA4GH. As Heidi again pointed out this morning, the matchmaker exchange actually started in IRDiRC. It predates GA4GH, although it really went to a different level, and I think took on a much higher level of activity, and really has benefited from this coordination between the two groups. And IRDiRC is also involved through Bartha Knoppers in the machine-readable consent task team that the GA4GH has also gotten going. So there, I think, are deep and continuing collaborations between our organizations, and we hope certainly that will continue. And to help make that continue, in Canada we launched last November, and we again as Genome Canada and CIHR with various other partners, provincial and other partners in Canada, launched a funding opportunity called Sharing Big Data for Healthcare Innovation, Advancing the Objectives of the Global Alliance for Genomics and Health. So this was a funding opportunity that was aimed specifically at strengthening the Canadian contribution to GA4GH. That competition has been adjudicated, and stay tuned because there will be an announcement in the near future about the outcome of that competition, and I think you will find it to be I hope you will find it to be a happy outcome. So that's all I have to say. Thank you for your attention, and I hope I kept the time.